Thank you guys so much for joining. My name is Sierra. I'm the CEO and founder of Elite Precision Consulting. Welcome to Global Healthcare Summit 3.0. As the owner of Elite Precision Consulting, we focus on global facilitation, meaning how you can work with teams around the world to accomplish your goals, your missions. And we wanted to have this summit to further highlight the great companies and talents in different countries around the world. Some of these countries we have done business in pretty extensively. Others, it's new to us. And we also wanted to learn more about what's happening in their region, what opportunities are there, also how they can enhance their global collaboration, what partners are they needing to bring on board to further their mission, and maybe you as an attendee, maybe you have that solution. And so we're here to talk healthcare related topics. Although our company handles multiple sectors, we really love healthcare. We've been in healthcare for 17 years and just wanted to further amplify that. Yeah, Mr. Dang, I'm very excited to introduce him. He's going to be sharing with us all of the great work that he's doing, all the impact that he's having. Thank you so much, Mr. Dang, for joining.
Thank you so much, Sierra. It's my great pleasure to exchange ideas about sustainable healthcare towards all the audiences from every corner of the world. And thank you so much for organizing such amazing events. Okay, so could you please allow me to share the screen? Oh, that's great. Yes, I prepared for some slides for today's events in order to exchange information regarding the understanding of the sustainable healthcare, as part of the healthcare transformation and healthcare reforms that has been implemented or that will be implemented in different parts of the world. Yes, so I'm joining the European discussion of the future sustainable healthcare system leadership and quality improvements right now. In order to try to find strategies to make the healthcare system more sustainable, more climate smart, more environmental friendly, and more, more resilient towards the future health crisis. Okay, so today we have only 15 minutes, so I try to, briefly discuss about some basic ideas right now, and discussed in European Commission, in European Union, as well as in the United Kingdom. Yes. So here, I try to explain what is the current naive understanding of the sustainable healthcare system, and also I try to explain how the healthcare and public health leadership may contribute towards the sustainable healthcare globally. And the third is about improvement. Quality improvement of the medical care, because sustainable healthcare should also consider to improve the system efficiency as well as the patient outcomes. Okay, so basically sustainable healthcare aims to deliver high quality healthcare without damaging environment. So there are some roughly goals. For example, the healthcare system, in particular healthcare facilities, should aim to reduce carbon footprint, should aim to reduce the medical waste, while improve the system efficiency and improve the patient outcomes and patient well-being. I mean, in the complex setting of the healthcare system. Okay, so for example, we see that here we have more details. For example, we should have sustainable primary care, sustainable mental health care, sustainable ICU care, intensive care units, sustainable end-of-life and palliative care, sustainable anesthetics, sustainable rehabilitation cares, and medical care is a complex concepts and complex operations. So in order to make sure the system is sustainable, we should make sure that every part of the medical practice and clinical practice should be aimed to be, to operate in a more sustainable way. Yes, of course, we say that the sustainable healthcare system includes strategies, perspectives, includes disease prevention and health promotion, includes institutional accountability, individual responsibility. It includes the the concerns of the environment from both the healthcare leaders and the healthcare staff. It also includes the quality, and quality is actually one of the most important pillar. I mean, that's my personal opinion. We have not made a agreement yet, but I really care for the quality improvement, while keeping the vision to the environmental sustainability for the healthcare system. Okay, so basically one of the pillars right now implemented, or not implemented, but at least for some medical centers in Europe and in the UK already started to try to building a climate smart healthcare. So what is climate smart? So low carbon healthcare interventions plus resilient healthcare interventions. Okay, so the goal is toward net zero of the carbon footprint of a medical center. Okay, so reducing carbon footprint, reducing the green gas emissions, and okay, very important is that the training of the healthcare workforce to learn about the climate change, okay, and the environmental sustainability, because the environmental sustainability of a healthcare system is built upon the awareness and the practice of every healthcare workforce, daily by daily, from case by case. Okay, so here the leadership, of course, plays a very important role. The leadership, the awareness that the leadership skills are essential to tackle sustainability challenges is, of course, very important, because the leaders can communicate climate and health message to staff and external stakeholders. It's applied in every healthcare systems, and the leaders could, play important role to refine and operationalize the sustainability plan and the measurements. Okay. Case by case, medical center by medical center, clinics by clinics. Okay, so here we roughly discuss what is the right now, what is the the stage of the quality improvement towards sustainability in the healthcare system. So first, we try to measure the sustainable value for healthcare. Okay, it's ongoing. To design a new measurement is always controversial, and always we need time to, to make it more practical and more realizable through, numerous discussions between academicians, healthcare managers, clinical staffs, and also decision makers, policy makers and the legislation. It takes a long time. So right now, there is a, SUS-QI framework. The SUS-QI framework is mainly implemented right now in England, so under the National Health Service System. So this framework tries to integrate sustainability into the quality improvement. So basically, I would say the SUS-QI framework may be helpful or may provide a vital message to healthcare leaders in other parts of the world, globally, okay? It might well have global influence in future. So we need to think about, and leaders need to think about, apply the sustainable value and measurements in practice to develop preventive care, holistic care, lean and low carbon care. So here, there is a question, how green is the medical facility? Okay, so we have green construction. For example, from the designing, architecture designing, okay, we should find sustainable size, sustainable architecture, focusing on water efficiency, focusing on energy, focusing on materials with low carbon footprint, focus on indoor environmental quality. Of course, there should be many innovations in the hospital constructions. So in the green daily operations, so the operation should be, sustainability should be integrated into the daily hospital operations. Okay, So including energy conservation, water conservation, management of the chemicals, management of medical waste, environmental services, and here environmental purchasing, I mean environmental purchasing of the medical supplies. Of course, we need innovations in every aspects, okay? So here, importantly, people to learn about the One Health concepts. It means human health, animal health, and environment are integrated together, okay? So by building bridges between physicians, veterinaries, environmental scientists, and public health professionals, the One Health initiative aimed to promote, improve, and defend the health and well-being of all species. So basically, human health, animal health, and environments are together, are integrated. So when the healthcare leaders are making decisions, need to think about the concept of One Health. Okay, so thank you very much for all the audiences.